Hello viewers, my name is Damilare. In this lesson, we'll be looking at the topic reproductive health. What is health? Health is a state of complete physical, mental and social well-being. You can remember with the letter CPMSW, the CP as computer, MSW as Microsoft Word, computer Microsoft Word, meaning when you see CP, that's complete physical. So health is a state of complete physical. The MSW, that's mental and social well-being, and not merely the absence of disease or infirmity, ailment, especially due to old age. What is this saying? Many people think that once they don't have disease, then they are healthy. No, it's more than that. The physical appearance of someone also, it tells if the person is healthy. The mental, talking about how the person reasons, also shows if he is healthy. Social well-being, how the person relates with people, also matters. So it's part of one's health. So, and not just absence of disease or infirmities. That leads us to reproductive health. When we talk of reproductive health, we are talking about the processes, the functions, the system at all stages of life. That means in terms of giving birth, there are some things you are expecting. Are those things coming forth? The childbearing, the processes that take place in reproduction, in giving birth. If those processes are coming up, if they are coming up the normal way, we say the person is healthy in terms of reproduction, because the expectation was not cut short. That means the baby came forth, the egg was produced at the right time, the sperm was produced. So all those processes and functions, the system of the person, it was successful at every stage of life. Another thing about reproductive health is that before they will be giving birth, there must be sex, that's coming together of a man and a woman. So if the coming together is safe, that means the safe sex life, then there is reproductive health. Another thing is capability to reproduce. If the woman is able to give birth, it means there is reproductive health, and that's what we talk about capability. Now we move to reproductive health care, talking about the guide the woman, the man needs when it comes to giving birth. What are the guide they need so that there will be a successful reproduction? One, family planning. They must know the number of the children they want to give birth to, when they want to give birth. That's family planning. And there should also be a follow-up after doing those family planning, because there are some family planning that will be done maybe inserting some things in the body of the woman. So they need to follow them up so that it will not later in turn affect the woman. So couples must agree on this. Another reproductive health care is prenatal. That means before birth or even during the birth, that's the delivery. The care that must be given to the woman before birth and while giving birth. That means the assistance they need. So this also determine reproductive health care. Another point we look at is abortion. Abortion must be prevented. That means make sure they avoid abortion, because in the process of abortion, deaths can occur, blood can be wasted. So there are a lot of consequences that can follow. That's what they call post-abortion. After abortion, there are some things that can occur. Another point on reproductive health care is that the reproductive tract where baby will pass, like the vagina, the uterus, the cervix. So there should be a prevention of infection. That means those passages should not be infected, because once there is infection in that reproductive tract, it can affect the baby as well as the woman. Also, things like STD, sexually transmitted disease that come as a result of sex, this must be monitored so that it will not affect the mother or the baby. There should be a treatment of systemic infections. That means if there is infection in the system of the mother, it must be treated before giving birth. Another issue is HIV, AIDS. Remember, when there is blood contact between man and woman, so if one of them is affected, so it can affect the other person, and in turn will affect the baby. Another thing about reproductive health care is infertility and subfecundity. That means it can affect production of egg or sperm. Once the egg is having issue or the sperm is having issue, it can also affect the production of the baby. So this should be prevented. Another thing is routine screening for urinary tract infection. That means the woman must keep checking that where urine is passing, hope there's no infection there, because it can affect the baby, it can also affect the mother. Also the cervical part, that's the cervix, where the baby will pass, hope there's no infection there. This needs to be monitored. Also cancer, hope the breast or the cervix are not having cancer, because the baby needs the milk in the breast, so that there will be no injury or issue with the baby. So, and there are some other women's reproductive health conditions. All these need to be cared for. Another one, there's what we call female genital mutilation, whereby the female private part will be tampered with, just as a male. There's what we call male circumcision. So if the female is now also doing circumcision, it can affect the woman. So there are some people, it is their own culture, it is their tradition to do this for female, but it's a dangerous thing, whereby they will be doing certain cuttings of the female's genital parts. Some, they do it for their girls, their young women, even without the approval of the girl. That means not that the girl was the one that decide or approved that. And some, they don't even have the full understanding and they do it. So they don't have the understanding of the consequence, what can come out after doing this kind of dangerous thing. And some, they see it as rite of passage from childhood to adulthood. They believe, oh, this girl is moving from a child to adult, so let's carry out female circumcision. And some, they do it from the range of 4 years to 14 years, though the age varies from area to area. Like in southern Nigeria, they do this female genital mutilation on their babies at the first few months of their lives. So there are different types of this same harmful traditional incision, this female genital mutilation. We have 4 different types here. The first one, circumcision proper. That's type 1. So it means if the female is doing circumcision just like a male, removing the foreskin, that's circumcision proper. The Muslim call it sunnah circumcision. Another one is called excision. This one is type 2, where they remove the glans clitoris. Clitoris is that part of the female that always stimulates the female for sex. That means it arouses the female. So trying to remove the glans clitoris, that's excision type 2, or the labia minora, that's the opening or the folding part of the external genital part. Number 3, we call it infibulation, that's type 3, which involve partial closure of the vaginal orifice. That means they close the vagina partially. So this is another form of circumcision that is done to a female. Number 4, we have introsition. This is type 4, where they cut into the vagina. They will go deeply into the vagina to cut or to split the perineum. So this one, they can use the machine, that's digitally, or they should take a sharp instrument, and it is the severest. It's so severe, very dangerous. So another thing we'll be looking at is importance of prenatal care. That means the care that is given before birth. Is it important? Yes. When you hear prenatal care, that's a regular medical and nursing care. That means the care they will be given to the mother regularly, the nursing they will give to the woman when the woman is pregnant. The essence of this is to reduce risk of complication, because there is what we call pregnancy complication. When they want to give birth, there may be issue. Another thing is for the baby, the infants. There may be a great risk on the baby also if there is no prenatal care. Then the third one, in terms of the drug the woman will be taking, the medication, to ensure that they are safe. So that's why there is need for prenatal care. What of postnatal, after birth? Does it still need care? Yes, the mother needs it so that she can recover from labor and delivery, the labor she went through during delivery, to recover. So there must be a care for that woman. And also to communicate with the medical professionals. That means the woman should be able to meet the doctors and express, okay, after birth, these are things I noticed in terms of the physical, the social, and the emotional changes she experienced. She had to relate this to the doctor. Also, in case stitches were carried out on the woman during the child delivery, so they must check if it is healed. That means as the stitch be healed, then the uterus, the womb where the baby comes from, they must also check if it has gone back to its normal size. The muscles that were used during delivery, have they returned to normal? So all this must be monitored. That's for postnatal. And also it will also help the woman to know the health status of the child when they go to the doctor. That's after birth. Another thing we'll be looking at is effect of STI. When the woman is having STI, HIV, or AIDS, how can it affect the baby, the fetus, that's the one in the womb, or the infants, the baby they are giving milk? So is there a way this STI can affect them? Yes, it can affect them by stillbirth. That means the baby can die after they give birth to the baby because of this infection. It can affect the weight of the baby. It can lose weight. It can affect the eyes of the baby, causing conjunctivitis. That's a pink eye. It can cause pneumonia to that baby, where there will be inflammation from the word flame, like fire, burning the air sac. That's the alveoli, the one that is exchanges gas. So it can affect it, so that it can affect breathing of the baby. Another thing is infection of that baby's blood. That's, they call it neonatal sepsis. Neo is new, natal is birth. So the newborn baby can be affected with infection because of the STI. Another one is neurological damage. Neuro from the word nerve. That's, the brain can be damaged. In terms of motor function disorder, that means when they ought to be bringing feedback, it can also affect feedback of the baby. Blindness, the baby can become blind or deaf, or having congenital abnormalities. That means the gene of the baby. Or there should be acute hepatitis. That's, hepat is for liver. Enter here, hepat, that's liver, just like hepatology, study of liver, or hepatic portal vein, the one that is carrying blood to the liver. So there can be hepatitis, anything itis, that's inflammation. So hepatitis, that's inflammation of the glomerulus, the one in the kidney. So it can burn the glomerulus such that the urine will start bringing out sugar and some food products, one urinating all those things that are useful in the body. Another one is meningitis. Menin is for brain. Itis, inflammation, means that there can be inflammation in the brain. Then there can be chronic liver disease, so as a result of the STI that the woman is having. Another one is cirrhosis. This one is also for liver, when the liver is having problem such that they replace the skin, the body of the liver, with some dead fibrous tissues. Another thing, second to the last before we round off, is risk involved in child delivery. When delivering a child, there are some risks that can follow. High blood pressure, forcing blood to come out during delivery. Another one is premature obstetrics labor. When you hear obstetric, it has to do with the baby, giving birth to the baby. So it means premature, when they give birth to the baby prematurely, that means not up to 9 months. So this can be a risk. Prolonged labor, labor that ought to be maybe within some minutes and is now taking hours or even days. So that's another risk that can take place in child delivery, take a long time to deliver. Uterine rupture, that's the womb. The womb can burst in the process. And finally, infection can also occur in the baby in child delivery. Finally, importance of knowledge of genetic disorder in family. It is good one have the knowledge of the family traits. What are the sicknesses they always have in one's family? So this abnormality can come as a result of DNA. So that there will be a kind of illness they always have in that family due to the gene. And this can be as a result of mutation. Sudden change can just occur in one of the genes of the parents. There's something we call sickle cell disease. This can be one of the family genetic disorder whereby they fall sick regularly. Another one is cystic fibrosis. Cystic, so it means there is a thick mucus in the lungs, in the kidney, in the liver, blocking all those important organs. And there may be cancer also in the genetic factors or in the family traits. Obesity, having fat, excessive fat in their body. Mental illness, that means the brain can be affected. They may also have issue of Alzheimer in the family. So it's good to have the knowledge of what kind of genetic disorder is in one's family. This Alzheimer, that's neurological disorder from brain. That means the brain having issue. It can affect the memory, the thinking ability of that person. There's another one we call Tay-Sachs. This Tay-Sachs, that's when there's a nerve damage. There's a damage in the nerves. So these are commonly affecting the person's brain. So it's good to have the knowledge of all these genetic disorder. Why? So that you'll be able to identify the likely disease that can come up. You'll be able to anticipate, expecting, okay, at a particular time, certain things can happen. And also it will help the family to prepare pragmatically and emotionally for all those expected challenges. So since they have the foreknowledge of what is happening in their family, like certain uncertainties, and know the caregiving stress, so that they will not be stressing themselves that why this, why that. They will have the knowledge, and also to prevent some losses. So they will have hope and also be able to find solution to the issue. And also they can identify effective treatment. They will know the right treatment to give to that person. Also teaching coping skills. They will know, okay, what are the certain teachings we can give this child, because when they have the knowledge of brain issue in the family. So, and also finally, they to be able to lead to better care given to that baby, how to manage the patient so that they can improve the quality of the life of that person. So thanks for listening.